open your Demo-Dose Inject-Ed, twist the bottom half of the plastic base to the left to unscrew. Using both hands, press the remainder of the base away from the skin. Push the skin out of the remaining ring. The inner foam is located inside the skin. Pull out the inner foam and wash by hand with mild soap and warm water. Rinse the sponge well and be sure to squeeze out all of the water before laying out to dry. Wash the skin by hand with mild soap and warm water. Rinse the skin well until all traces of soap have been removed. Then dry completely in a cool place. The skin may feel tacky to the touch after washing. This is normal. You can apply a small amount of talcum powder to the skin to help with this. The base unit may be hand washed using mild soap and warm water, then left to air dry. To reassemble your clean Demo-Dose Inject-Ed pad, first replace the inner sponge. Next, fit the skin into the base. Using both hands, press the base pieces together until they click and screw on the bottom half of the base by twisting to the right. Your Demo-Dose Inject-Ed is now ready to be used for instruction. Pair it with the new Inject-Ed holder for a wearable trainer, Pocket Nurse powder-free nitrile exam gloves, and practice injections using Demo-Dose simulated medications. For more information, head to pocketnurse.com.